Each year, more than 46 million Americans will seek emergency room treatment for an accidental injury, most of which are preventable. So, what are your risks, and who can you trust to protect you? This is Safety Matters with Russ Kenzior.
This is America's Slip and Fall Guy, Russ Kenzior. Thanks for listening to my show. As usual, I'm joined by my producer, Tony.
Good morning, everybody.
Tony B.
We have a great show planned for you today.
Well, we certainly do, and we always start out with the same thing.
Safety Matters in the news.
Yes, what's in the news?
What is in the news? Well, I think we know.
Yes.
Coronavirus.
Aren't you kind of tired about all this stuff?
I'm exhausted. I think I'm like most people. I am just totally exhausted.
Yeah.
In fact, my wife she doesn't even want to hear anything anymore. It's all negative. It's so depressing, so confusing. But we talk about it because it is...
Safety Matters in the news.
It's in the news.
Yes.
So what is in the news this past week? I don't know if you listened to Fox News with Chris Wallace.
Yes, I did.
This past Sunday?
Yes.
Well, he had the former head of the Centers for Disease Control, Tom Frieden, on the program, and did an interview with him that I got to tell you, just was stunning. I mean, there was so much in that interview that just...
I agree.
I couldn't believe it.
I agree.
And I'm going to play a little bit of it for you right now.
Please do.
Why do you say, as you did, I think this week, that this pandemic is going to be with us, quote, for years?
Well, the virus clearly has the upper hand in the U.S., and what we're learning around the world is it doesn't go away. Unless you're an island and able to keep it out entirely, the best case scenario is a community that rapidly finds cases and rapidly stops them and prevents the kind of explosive spread that we have in the U.S. It's really clear that there's a lot of spread in bars, probably a lot of spread in indoor dining and restaurants. So really, we've got a choice. Do we want to close the bars and probably the indoor dining and give our kids a chance to learn in person in the fall or not? That's our choice. And in the Northeast, basically, we've made that choice. Cases remain low, and if it keeps low, we'll be able to start some form of in-person schooling in many communities in the fall.
Yeah.
Where do you begin with misinformation? I mean, I don't know how else to put it. This statement that it's clear that people are getting the coronavirus from bars and restaurants. I mean, it would perhaps make sense that there may be more transmission in bars than restaurants. But where's the evidence? Where's the contact tracing showing, hey, people are going to a particular restaurant and they're getting the coronavirus and spreading it? I've not seen that. I've looked for it.
And there's no mention that we're testing so much more accurately. And none of that's mentioned in any of the part of the news.
No, but he will bring that up later in the interview. But this, again, message that says that it's clear that people are getting the coronavirus by eating in restaurants and going to bars. And I just don't know where that evidence comes from.
Yeah.
I mean, says who?
Where's the science in that?
Well, where is the science? And again, we're told over and over and over and over, we go where the science and the data takes us. I can't quite find where that is. But he also, aside from closing down the bars and restaurants, which I'm going to talk about in a little bit, he kind of presents this binary choice of, we can either shut down the bars and restaurants or send our kids to school. In fact, let me play that one clip for you.
It's really clear that there's a lot of spread in bars, probably a lot of spread in indoor dining and restaurants. So really, we've got a choice. Do we want to close the bars and probably the indoor dining and give our kids a chance to learn in person in the fall or not? That's our choice.
That's our choice.
Yeah.
Well, guess what? Closing down the bars has nothing to do with opening up the schools. If you remember on the first episode, I give a lot of definitions of, what it means to be this, science, what it means to be average, what are the difference between means and...
Right, they throw out all these words.
Yeah, a lot of technical terms. Well, he just threw out what's called a false binary choice. Binary choice is a decision or a choice between two alternatives, but they're not connected. For a good example, that is you can either take action or not take action. Binary decisions are, really kind of a basic understanding in the world of logic or mathematics, but a binary choice is yes or no, good or bad, up or down. There's no connection. And what he's saying is there is a connection, and there's a connection between opening restaurants and bars and sending our children to school. Now, obviously, children are not going to bars. I'm not certain where that relationship comes, but it's kind of this ultimatum. I just feel every time the subject is on the news, it's always this dire circumstances and ultimatums. Either you do what we tell you or the world's going to come to an end.
And these bar owners, could you imagine hearing that on the air? Here you are, you're barely making it. You're trying to pay your bills and then hearing this on the radio.
Yeah. You hit it right on the head. There's also a term called mutually exclusive. You probably hear this all the time. Closing restaurants and opening schools are mutually exclusive. Again, that's a term used in logic and mathematics, probability theory, that two events are mutually exclusive or disjoint if they cannot both occur at the same time. For example, turning left, turning right, going up, going down.
Right.
You can't do both.
That's right.
Well, he's kind of making it sound like we can't open schools and keep the bars and restaurants open. And again, I want to believe that the people we're listening to, the experts we're taking, our advice from, are really acting in our best interest. And I'm beginning to feel like I'm just tricked all the time. This kind of messaging. In fact, the interview went on.
Where does the U.S. stand compare with other big industrialized nations in terms of its handling of the pandemic?
Well, I'll be frank. We are a laggard. We are one of the top in the world in terms of the cumulative death rate. And unlike many other countries that have high death rates, ours is continuing to increase. We're continuing to have many new deaths. And Chris, one of the things that concerns me most is that we're not on the same page. My group looked at all 50 states, what's on their website, and most of the essential information isn't there. Every person in this country should be able to know very easily what's the risk in my community and how well is my community doing bringing that risk down so I and my family can be safer. To do that, we need simple things like not how many tests are being done. That's a useless number.
Why is it a useless number? You gotta be kidding me.
Wait a minute. I thought this past March, Dr. Fauci, Dr. Burke, the whole country was focused on we need more testing.
Oh, yeah.
Wasn't that the whole race? The race to come out with a fast test and hurry.
Absolutely.
Let's get people tested.
But that was yesterday's news.
Well, I guess testing just doesn't matter anymore.
No.
It just doesn't matter anymore. And, what was kind of interesting is he used a word I've never heard of. He used a word called a laggard. Did you hear that?
A laggard.
We are a laggard.
A laggard.
What is a laggard?
Man, I have no idea. I have no clue. A laggard.
We are a laggard.
I don't know. It's not. I have no idea. So I looked it up.
Is it like a lackey, like a sub noun to that?
There's no definition, Tony. It's not a word. It's not in the dictionary.
Not in Webster.
Nope, can't find it. So the only reference I can find to the word a laggard.
We are a laggard.
Is Old English. It goes back to William Shakespeare, 16th century.
To be or not to be.
Well, it raises the question: why use a word that doesn't exist? It's not even defined. What's the point? Is it?
They're talking down at us. Yeah, you got to use a big word. You don't know what I'm talking about.
Right.
I do.
Trust me.
Yes.
But I have to imagine a lot of people viewing that show also ask the question, well, what does that mean? Why not just say, hey, we've been slow, we've been ineffective,
I'm a laggard.
Testing is useless. We just spent months and God knows how many billions of dollars ramping up tests like you wouldn't believe to just hurry. Let's test everyone. And his message is, as he said, testing is useless.
Yeah.
Now, this is the former head of the CDC. And again, this, it's our choice. And he talked about on the Northeast. Here in the Northeast, we made that choice. And I'm like, again, what's with this Northeast thing?
Well, New York does it better.
Well, do they? Look, if we follow the science, if we follow the data, we know decisively where the people in New York and New Jersey most of them had died. Where are most of the fatalities in New York and New Jersey?
In the old folks' homes.
That's right, nursing homes. We know that.
Yes.
So are they proposing closing the nursing homes?
They have.
I mean, is that the solution?
And then you hear about all the poor. Nobody can go see them. Their sons and daughters. They can't go see their moms or dads in the old folks' home.
So again, it's just confusion.
A laggard.
I listen carefully.
So what is it what is again the definition of a laggard?
Well, a laggard is again an Old English term meaning slow, meaning just a slow reaction. But it's a term that was used by William Shakespeare. It's not in the dictionary. And again,
he could have used just a simple term.
Well, who's he speaking to? I mean, who's the audience? Yeah. And again, I'm not trying to be critical. I'm just trying to get information from somebody who's being purported as an authority, as an expert, the former head of the CDC, and his advice is 100% contradictory to what we just learned 3 months ago, right?
Yeah.
And he goes on to talk about how we as a community have to understand our information, our data. What's your community doing? What are you doing to bring down the number? And I thought, well, that's a valid point. And we do have that information here in North Texas. We have multiple sources. The one I use all the time is the Texas Tribune, which you can get at texastribune.com. And it's a really great website that gives kind of a day-to-day, I think it's even updated several times a day, about what's going on with the coronavirus. And so if we want to take a close look at what's going on in North Texas as it relates to the coronavirus, as Dr. Frieden said, well, let's take a look at it. In Dallas, we had 46,000 cases, and that resulted in 636 deaths. And this was just a couple days ago. Tarrant County, 25,146 positive tests of coronavirus, 344 deaths. By the way, that's 1.37% death rate. Very low. Denton County, Collin County, we can go down the list and really talk about what is going on with the coronavirus and what's going on with the businesses that are being affected by it. So when we come back, we're going to talk more about the community that we live in here in North Texas, what's happening in the world of coronavirus, how many people are infected, how many people are dying, and just how is this affecting our local business community when we come back. This is America's Slip and Fall Guy, Russ Kenzior, thanking you again for listening to the Safety Matters Show. I was talking about the effects that coronavirus has had here in North Texas. That, again, was a recommendation from the former head of the CDC, Tom Frieden. And I think it's worthy of discussion. We need to understand how is the coronavirus affecting us, specifically North Texas. And again, I'm relying upon as a source the texastribune.com website, and this is data that was published on July 27th. In Dallas County, Tarrant County, Denton County, Collin County, and Rockwall County, which pretty much takes most of North Texas into account, there were a total of 84,718 people tested and resulted in a positive test for coronavirus. Of those, 1,119 have died. So if you were looking at the statistics, 83,599 of the people who were tested positive had recovered. That's about 1.3% fatality rate and a 98.7% recovery rate. So 98.7% of the people who test positive recover, and 1.32% don't. So the numbers are pretty obvious that we're doing a pretty good job. I would assume we're doing a pretty good job. That's a very, very low fatality rate. But there's a lot of things we know, and there's a lot of things we don't know. For example, what is it we know? Well, we know how many people are getting infected. We know how many people are being tested, because we're testing millions of people in this state. We know that the numbers are trending down. In fact, just last week, the number of positive tests were reduced by almost 50%. When we do the daily numbers, we were getting somewhere between 8 and 10,000 a day. We're now at about 4,000. Now, again, I'm not saying that's good news. It's not like we're conquering the coronavirus, but we certainly are turning the tide. And so what we know is that the numbers are getting better. We know that as far as North Texas is concerned, there's really a relatively low number of cases. For example, in Rockwall County, they had 635 positive cases and 16 deaths in the whole county. 16. There were probably more people died as a result of an opioid.
Or an accident.
Or suicide. Or
slip and fall.
Could be. 16. In Collin County, 5,762 cases, 74 deaths. Pretty small number. Denton County, 6,043 positive tests were returned, 49 deaths. Pretty small numbers. And again, if you compare that to other forms of fatalities,
right,
nothing to really be that concerned about that you're going to shut your life down. I mean, we are literally, as a country, as a state, just shutting down our lives. And this is time you'll never get back. This is a year that for many people who are just shutting it down, we'll never get back. It's a massive loss of everything: productivity, time, energy, money, happiness. It's just a horrible, horrible time in American history, and it's one that certainly every generation will remember. Now, what is it that we don't know? Well, we don't know of those who have died. What were their underlying medical conditions?
How old they are?
Yeah, the comorbidity. How old they were, what medical conditions did they have?
Did they just come off an accident?
We don't know. Well, we don't know. We know a number, but we don't know who makes up that number. We don't know who the risk classes are.
And you don't know if that number is relative to the same time. I've heard that sometimes they've just found something from a couple months ago, then they add it to the new number.
Yeah, how many of those are false positives? They never really were a positive, but they added them up anyhow.
Right.
And we can go on and on and on. And for most people, Tony, their heads just explode.
Right.
They cannot absorb the meaning of this information. They listen to our leaders, the officials, just constantly give us bad news. And any type of good news, and any type, is always just played down.
It's all the fear.
Fear. It's all about fear. It's about getting the American people so scared that they don't know what to do, that they stay in their home, that they don't go out, and outside. They don't go out and spend money. And that's our entire economy is based on people going out and spending money. It's something that is just devastating to so many of the small business owners, not only in North Texas, but everywhere. In fact, I'm going to use as an example restaurants. They just seem to be the target. It's always shut down the restaurants, shut down the churches. I mean, it's always the same target.
Right.
I mean, I read a story that, of all these protesters that were out a few weeks ago, about a month ago, for the George Floyd protest, that ultimately contributed in big numbers to the virus, that many of them would go out and socialize. They were going to restaurants, they were going to bars, they were socializing. Now, isn't it obvious to think that the reason that these people got the coronavirus was because they were packed together, shoulder to shoulder, yelling, spitting on each other, contracting the coronavirus, and then when they went to a restaurant, the restaurant was not the source of the coronavirus. It was just a place they happened to go. But yet the restaurants get blamed. And again, I'm looking at the contact tracing data, and I just can't find any evidence that people are getting sick by going to restaurants.
Or a hairstylist.
Yeah, I mean, where's the data?
Or at a church.
Yeah, I mean, here in Texas, we have over 50,000 restaurants. $70 billion. Did you know that? A $70 billion industry. I mean, just a really, really big industry. It employs 1.4 million employees. And Restaurants are just closing. I mean, they're closing all the time, and we don't know what to do. In fact, there was an article that I read last week put out by ABC News, and it was based on Yelp data. And the article is entitled, "Nearly 16,000 restaurants have closed permanently due to the pandemic," Yelp data shows. 16,000 restaurants have closed permanently. These are real people. These are people's livelihood. This is their life. This is how they pay their bills. This is how they afford to send their kids to school. 16,000.
And of course, the domino effect. The distributors, the truck drivers,
Yeah.
the people that do the deliveries,
It just cascades.
the workers, the bartender.
It says that there were 26,160 total restaurant closures. And the story goes on to say abrupt closures, inconsistent reopenings, changes in public health guidance for operations, and other state-mandated orders have pushed the food industry to the brink. It says more restaurant food service industries have lost almost or nearly $120 billion. $120 billion has been lost due to the pandemic. It states that new data from Yelp revealed the stark reality of permanent closures for an alarming number of restaurants, which have already ran on thin margins. The review cites latest economic impact report released Wednesday, just this past week ago, showed that 60% of restaurants that temporarily closed due to the pandemic have since shuttered for good. They're done. They're not coming back.
60%.
60%. It goes on to say there were 26,160 total restaurant closures on Yelp as of July 10th, and 15,770 of those have made the decision to permanently close.
Not to reopen.
Imagine how many people are affected. The owners, the workers, the customers, the distributors, the suppliers.
The domino effect.
It says that the restaurant industry now reflects the highest total business closures recently surpassing retail.
Oh, my goodness.
And so we keep hearing from our government we need to close down restaurants.
So, Russ, what do we do?
First thing we have to do is take a deep breath, understand that what we're hearing is greatly exaggerated. There are many, many people that have a microphone, that have access to the media, that are providing opinions, which are not always fact-based or data-based, but rather reflect an agenda. They simply are promoting an agenda.
The narrative.
Right. So we're not real certain as to what is going on. And so, when in doubt, you have to trust your instincts.
Agree.
Look out for yourself. Just look around. Drive around your community. See what's happening. I mean, how many people do you know that have the coronavirus and died?
I don't know any.
How many people have the coronavirus that got it, got sick, or maybe never got sick? Many of those people we don't know.
Right.
But look around. Where is this, sky is falling epidemic that's just killing people like it's being promoted like the plague?
Millions and millions of people.
We are led to believe that this is the plague. And what really has troubled me, probably more than anything, and I really resent it, is that we are now turning on each other. We're now looking at others who don't wear their mask. And they're the problem. You see, it's that guy in the mask, without the mask in front of me, at the grocery store.
Who refuses.
It's this viewpoint that we have all been kind of programmed to hear, to believe, that it's our fellow citizens, our fellow members of our country that are the problem. And if you're not helping, if you're not wearing your mask, if you're not social distancing, if you're not doing all these things that the government tells you to do, then somehow you're the problem, and you're going to be lectured to. Coming up next, I'm going to talk about health and safety, injury prevention. Is a science that's based on a combination of risk factors, exposure rates, and ultimately sound data, which we believe is being provided to us and we rely upon by our leaders and public officials. But you may be surprised when you learn who are these experts and what really is their agenda.
You are listening to Russ Kenzier. Safety Matters. We'll be right back.
This is America's slip and fall guy, Russ Kenzior. Thanking you again for listening to the program. Joined with my producer, Tony.
Hello.
In this whole issue of coronavirus and listening to our leaders and experts in the field, it's surprising when you do a little bit of research to find out kind of who some of these people were or are.
Like, who is this Frieden?
Yeah.
Frieden. What is he doing now? I mean, he's a former CDC head of the CDC.
Right. Former head of the CDC is a very active spokesperson. Tom Frieden seems to be on a lot of Sunday morning shows.
Right.
First question is,
yes.
what?
So why did they interview him instead of the head of CDC?
Exactly. I think that's what most people would say is, why do you get the former head of the CDC? Why not just get somebody from the CDC?
So there's an agenda here.
Well, yeah. Now, you got to parse through and try to figure it out. For example, in the interview that I played earlier, Dr. Frieden referred to his group. He said, my group looked at all 50 states.
Who is his group?
Who is his group? He's not with the CDC. So who is his group? Well, I did a little research. I went out there and you don't have to dig real deep to find out a lot about Dr. Frieden. The first article I have kind of floored me. It's entitled, Ex-CDC Chief Frieden Settles Sexual Harassment Charges. And this is from Stat News. Dr. Thomas Frieden, the former head of the Centers for Disease Control and Prevention, settled charges of sexual harassment Tuesday with a guilty plea to a lesser violation. This is, by the way, dated June 4th, 2019. It says Frieden, who led the CDC from 2009 to 2017, pleaded guilty to disorderly conduct, striking a deal that would leave him with no criminal record if he stays out of trouble for a year, according to press reports. It says Frieden had been charged with forcible touching, sexual abuse, and harassment in connection with a 2017 incident in his Brooklyn, New York home. And it goes on. I didn't know that. So, okay. So the story goes on, and it's really the part I was looking for. It says, upon leaving the CDC, Frieden founded a non-governmental organization working to combat disease outbreaks with chronic diseases globally. The organization, called Resolve to Save Lives, is part of the group Vital Strategies. Well, okay, fill me in. Well, Resolve, according to the story, Resolve is funded by 3 organizations. Bloomberg Philanthropies, which Dr. Frieden worked for Michael Bloomberg when he was in New York, which is a charitable foundation run by, again, his former boss. And it's also funded by Chan Zuckerberg, Mark Zuckerberg's wife.
Go figure.
The Chan Zuckerberg Initiative, and Bill and Melinda Gates Foundation.
Of course.
So that's who's funding. I guess that's the group. And so I did a little research. I didn't know Chan Zuckerberg had a non-for-profit that was funding this program, this company.
So this is my people then.
I guess this is his people, but I wanted to find specifically his people. So if you go to the website for vitalstrategies.org, that's the parent company. There's a message from the president and CEO, who presumably is Tom Frieden's boss. His name is Jose Luis Castro. And if you go into their website, there's a section on their background, their mission statement, et cetera. And it says the world's healthiest future is dense, urban, and green. And again, I'm just reading from their website. Currently, half of the world's population lives in cities. And by 2050, that number will grow by 2.5 billion more people, and close to 90% of that increase is occurring in Asia and Africa. And so there's a lot of disease taking place in cities. It says that repeatedly, cities are proving their potential to drive large-scale innovations in public health. We have helped mayors and other local leaders pioneer, wait for it, Tony, smoke-free laws, protecting people from working in restaurants and offices filled with smoke, and inspiring people to quit. These are the people that are putting a lot of energy in public opinion in big cities to, prevent people. You can't even smoke outside of buildings now. in many cities. I mean, the smokers are just kind of like outlaws. It goes on to say, we have worked with city leaderships where road crashes are the leading cause of death among young people, young adults, to redesign intersections, promote seatbelts and helmets, and reduce, it says drink driving, but I think they mean drunk driving. Okay, that's good. That's kind of what the National Safety Council does. But get a load of this. It says, we've helped cities keep sugary drinks and junk food out of schools where teachers were once paid to promote them.
Is this the group that was behind in New York?
Yeah. So this is a social justice organization, kind of sort of masquerading as a science organization, but their whole message is about moving an agenda. It goes on to say, and again, I'm just quoting from Dr. Jose Luis Castro, the president and CEO of Vital Strategies, the parent company by which Tom Frieden works for. It says that at Vital Strategies, we believe the world's healthiest future will be urban, dense, and green. Not certain where that's headed. He says that we've seen how cities can pilot programs that are eventually adopted by national governments. And conversely, we've seen how essential cities are to implementing national programs and policies.
Urban, dense, and green.
Right.
What is urban, dense, and green?
Exactly. And what does that have to do with the coronavirus? What it clearly says is this is an organization that's well funded by three, fair to say, far left organizations that have an agenda to act in some way, shape, and form to influence big city leadership to adopt these green initiatives. Well, again, I'm not certain where the intersection is with coronavirus. So when Dr. Frieden talks about his group, his people, his company, how many people know that he's referring to a social justice organization, not a science organization? This isn't like a research lab.
My people.
Yeah, my people. Okay. That being said, it lends itself to the next question. Well, what is he really trying to push?
Russ, what is he really trying to push?
Well, he's pushing something that is far different than what I would assume his message is about. And again, why not just bring in somebody from the CDC? I don't get it. Another story came up. This is on Fox News. It says, this is the title, as coronavirus cases surge, Dr. Birx, remember her, the lady with the scarf?
Yes.
Dr. Birx warns that 11 cities need to take, quote, aggressive action. The story says that 11 major cities need to take aggressive steps to mitigate outbreaks of coronavirus, says Deborah Birx. During a phone call Wednesday with hundreds of state and city officials, Birx explained that Baltimore, Cleveland, Columbus, Indianapolis, Las Vegas, Miami, Minneapolis, Nashville, New Orleans, Pittsburgh, and St. Louis were not doing enough to combat outbreaks in their cities. Now, that tells me the people of those cities are just not doing a good job. All right. I mean, it's how it's always just, the folks that live in these cities just aren't doing what they're supposed to do. It goes on to say when you first see the increase in test positivity, that's when to start the mitigation efforts, Birx said in a recording obtained by the Center for Public Integrity. She goes on to say, I know it may look small, and you may say that only went from 5 to 5.5%, and we're going to wait to see what happens. If you wait another 3 or 4 or even 5 days, you'll start to see a dramatic increase in cases. And that's a quote. Well, doesn't the opposite work? When you start to see a dramatic drop in cases, doesn't that kind of continue to trend out? Why is it always the negative?
They don't want to talk about that. That's not their agenda.
She goes on to criticize the, quote, Sun Belt states.
Oh, of course, they got to hit Texas.
But she'll actually say, and I'll read this, while Birx noted encouraging declines in positive tests results in the Sun Belt states, she warned that the virus would start moving north. So I guess the folks in New York are going to get a second round. Again, what do we do? test, don't test. Positivity rates are high, but fatalities are low. I would say that's good news. Everything's kind of trending in the right direction, but it seems like whenever there's good news, the experts never find there to be good news. It's always bad news. It's just repackaged bad news. I mean, am I missing something here? I mean, it's very frustrating. And as a safety expert, it's one of the things that me and my colleagues in the safety profession find very frustrating, because we just want to get good data. We want to take that information, use it as a tool to prevent accidental injury, or in this case, reduce the pandemic. So it's just hard to do that. When we come back, we're going to talk about who is the CDC and what role do they play in the fight against coronavirus, and we'll talk about workplace and home injury statistics. Question, Tony, are you safer at home or at work?
At home.
Okay, we'll answer that question when we come back. This is America's Slip and Fall guy, Russ Kensior. Thanking you again for listening to the show. We've been talking a little bit about the coronavirus, in fact, a lot about the coronavirus. And one organization, agency that's been kind of on the front lines of this has been the CDC, Centers for Disease Control. Do you know anything about them, Tony?
I don't know. I tell you what, I think they're under their desk. Where are they?
Probably under their desk. Well, actually, there's 10,600 employees for the CDC. So that's a lot of people under their desks. They have an annual budget of $1.1 billion.
A lot of money being spent.
Yeah, a lot of money. Forbes magazine, Forbes.com, did an interesting story that talks about the CDC, specifically as relates to pandemics, epidemics, that sort of thing. This dates back to February of this year, February 29th, where Forbes magazine says taxpayers are rightfully wondering if billions of dollars they send to Washington every year will help keep them and their families safe. The story is really quite interesting. It talks about the staffing. They had a 28% increase in their headcount since 2007 to 2018. So they went from 8,325 employees to 10,639. There's a lot of them, a lot of people, which makes you ask the question, why aren't any of them doing interviews?
I have no idea.
Why do we get the former head of the CDC when there's 10,000 of them that I assume could, stand behind a camera and microphone? They're well compensated. They got a 51% increase in total compensation, salary, bonuses, differentials, awards since 2007. 51% increase. Did you know that?
Yeah, so, throw more people at it. Throw more money at it. It's not working, but keep on throwing money.
Yeah, that's the American way, isn't it? According to Forbes, they have some of the most highly compensated executives. They say that there's 168 key employees at the CDC who earn more than $200,000 a year. These top employees made $38 million last year, average of $226,000 each. And that the top 35 doctors, I presume they mean medical doctors and or researchers and scientists, made between $250,000 and $288,653 last year. So they're getting paid pretty well. And again, we hear all the time, we're in this together, right?
Yes, right.
So as we're closing down restaurants and barber shops, and those people are literally put out of business.
They get a pay raise. They're collecting a check.
Yeah. And they're lecturing us about how we're not doing a very good job.
They're in it together.
Yeah, we're in it together. Forbes goes on to talk about how the agency can do better. They found that $9.4 million over 4 years were spent on frivolous positions. Photographers were paid $612,000. Woodcrafters, not certain what woodcrafters are doing there, but they paid woodcrafters $1.2 million. Interior designers, $1.6 million. And, of course, architects who work with interior designers, $6 million.
I want a room with a view.
I guess they have to make it prettier. None of that has to do with the mission of the CDC, which is to protect us from disease, right? I mean, isn't that where the money should all be going?
Russ, I think you need to tell what Tell us what's really on your mind. Come on. I sense something coming on.
I am just so exhausted. The more you dig into this, and look, people are exhausted. They're tired. They're angry. They don't know what to do. They just want to go and, look, I just want to go to a restaurant and have something to eat without having to wear a mask. We're frustrated. We're angry.
Or worried about the other person being upset that you're not wearing one.
And we've just kind of devolved with an attitude. I mean, people are just unhappy, angry, scared, blaming each other. And that's the thing that kind of gets me more than anything, is hearing our leaders kind of pit one person against another. Well, you're not wearing your mask. You're a bad person. You're jeopardizing everybody's health and safety. Well, maybe not. If you're sick, stay at home. If you're concerned, stay at home. Wearing a mask is a good idea when you're in public. Everybody I see does that. I mean, we're social distancing, doing the hands. I mean, we're doing everything we can. And I just don't like being, put down. I don't like being criticized by the very people we pay $288,000 a year.
With a room with a view.
Right, and need a new design.
And woodcrafter.
Yeah, woodworkers. And I think that represents the view of most Americans. It's an election year, so I understand that, no matter what news is put out there in election years, always having something to do with the elections, state, local, obviously federal. We have a lot of people up for office, and it's a contentious race, as it is every year. But the American people are always stuck in the middle of a political agenda, right? Isn't how it always is? And here we are, yet again, stuck in the middle of a political agenda. And as a safety professional, I take my job very seriously. What I do and what other people in my profession do is all about protecting other people from unnecessary risk, unnecessary injury, or preventing a transmission of some form of disease. Now, I'm not an expert on coronavirus. I've said that, I think, every show, but I am a safety expert. And you don't need to be a epidemiologist to understand that the numbers, the data that we're constantly bombarded with, for the most part, don't exist. I mean, I look all the time. I can't really find it.
Why don't you make some comparisons on, all the statistics that are out there compared to how many deaths happen in a day?
Well, coronavirus is a serious problem. But yeah, let's look at numbers. Poisoning. People that get poisoned. How many people do you think a day get poisoned, die of poisoning in the United States?
30.
170 people a day die as a result of being poisoned.
More people die of poisoning than the coronavirus.
Yeah, depending where you live, that could be absolutely true. 62,399 people died in 2018 from poisoning. Now, obviously, coronavirus numbers are bigger than that. Motor vehicle accidents. How many people? Well, I can't do this to you, Tony.
Yeah.
All right, let me ask you a better question. Are men more likely to die or women in a car crash?
I think men. Good job.
Yeah, you did. You got it. And I think that's intuitive. 27,953 people, men, died as a result of a motor vehicle accident, while there was 11,451. That's 108 a day. Falls are right behind that. 103 people per day die as a result of a fall. Now, these are falls generally from an elevation. So when I say falls, be careful. I'm not talking about necessarily slips and falls, what are called falls from the same elevation, but falls off of a building. So if you're in the construction industry, the fatality rate is very high for falls because you're falling from a very tall building for the most part. I'm just going to pick another one randomly. Drowning. Here it is summer, Texas. People are out swimming. You hear about drowning deaths on the news. Just give me an idea, Tony. How many people you think per year will die as a result of drowning? Not necessarily in the lake. It could be in a bathtub.
1,000.
Tony. 3,710 people died as a result of drowning in 2018. Most of those men. That's 10 people per day. Okay? So, put it in perspective. Coronavirus, drownings, slips and falls, choking, car crashes. We can go on and on and on with all the risk we face every day, everywhere.
But we don't stop living.
Well, that's the key, is the minute you give up and you surrender, you lose. I mean, there's safety everywhere. Everywhere you look, there's some safety issue. There's some level of risk. And that's what this show is about. This show is about finding everyday safety topics that are in the news, and we talk about them and how they affect you, your family, and your business. Now, we've been stuck on coronavirus. Why? Because that's all that's in the news. I mean, there's nothing going on. I mean, everything's over except coronavirus. And our leaders, the media, often use safety as a weapon to scare people. People are scared. And they do that to get people to take some form of action in accordance with a specified agenda. And we don't question them. We just believe, and we obediently follow whatever we're told to do, and don't even give it a second thought that the people who are preaching this to us may really not be in a position to be preaching to us. I mean, how often do you hear advice on, masks don't work, masks do work? One story comes out only to find they were wrong, their predictions are wrong. Nobody ever apologizes. You just never get an apology like, gee, we got it wrong. It's just, their predictions are wrong, and they move on, and we just kind of go on to the next crisis. And when people fear for their safety, they become very vulnerable, Tony, to manipulation, misinformation, propaganda, and people in power know that.
And they take advantage of it.
They certainly do. And fear is a very powerful motivator. And our leaders and the media use that to shape people's behavior. Our leaders and media get away with it because they know most people are not safety experts. They don't know any better. They believe what they hear. And they're inherently trusting. American people are very trusting. We want to believe that what we're being told by our government is for our own good. To trust us. We're looking out for you. We're the experts. We know. Only to find out they really don't. I hate to be so cynical, Tony, but my 30 years of experience as a safety advocate, expert, witness, and safety expert, I've seen it all. I mean, it's the reason for the show. It's why I do the show, to share my real life experience with people who don't have my background, to bring them forward, to let them lead safer, healthier lives, and do so in a positive way. We are Americans, and we're Texans, okay? We don't really like folks telling us what to do. And if we do it, you better be right, okay? So if you want to tell me that you're with the government and you're here to protect me, right off the get-go, Tony, I'm not believing you, okay? And again, I hate to be cynical, but that is where we are. Next week, we're going to be talking about the crisis of the day. Do you remember what was on the headlines a year ago?
With all this corona stuff, I can't remember.
Well, most people can't, because that was a year ago. But we're going to talk about crisis. We're going to talk about all the trigger words, terms like surges, tsunamis, that the media uses every day to scare us. And so until then, thanks again for listening to my podcast from Russ Kenzier, the Slip and Fall Guy, and
Tony B. Have a great week. See you next week.
Well, this brings another show to an end. Thanks for listening. If you have a question you'd like me to answer or would like to suggest a show topic, I'd love to hear from you. You can reach me at my Twitter account, which is @TractionExpert, or send me an email, russ@thesafetymattersshow.com. If you'd like to listen to my Slip and Fall Guy podcast, you can do so on either Apple or Google Podcasts. Or if you just want to learn more about my work as an expert witness, want to purchase an autographed copy of one of my books, you can do so at my website, tractionexperts.com. Until then, have a safe day.